The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. This is Veronica Posada. Thank you very much for attending today's webinar with Health Gorilla. I want to let you all know that you are muted. You can ask questions at any time during this presentation. On your panel, you'll see the window for questions. Please feel free to type in your questions in there, and we'll make sure to answer them. So this webinar is Health Gorilla powered by, it's LabConnect powered by Health Gorilla. And I'd like to go ahead and provide you a brief bio of our presenter, Sergio Wagner. Sergio is the Director of Business Development at Health Gorilla, and he is responsible for the development and nationwide growth of the Health Gorilla marketplace. Sergio is a seasoned healthcare executive and consummate team player with the ability to develop, educate, and implement sophisticated business development strategies with superior results in tight timelines. I'd like to go ahead and also start here with 3 poll questions before we get started with the webinar. First question, how many diagnostic faxes does your practice receive daily? Please answer one of the multiple choice answers there, and we'll give you about 15-20 seconds. Next question, how much time per day do you spend organizing faxes? Okay, now we'll go into the last question. Would you like to seamlessly share diagnostic data, labs, and radiology with your colleagues? We'll share these answers with you at the end of the webinar. Okay, we'll close the poll.
Real quickly here, this is also Dustin Brown sitting here with Veronica. Before I turn this over to Sergio, or we turn it over to Sergio, I want to mention we've been working with Health Gorilla, which is formerly known as Informatica, for about the last year, and just over the last, I'd say roughly 5-6 months, Veronica, we've been really getting this out into the community of our members, and over the last few months, there's been a strong uptake in its adoption. Which is why we thought it'd be pertinent to get another webinar put together and also have lunch and learns that we're going to have our first one tomorrow, and Veronica will cover more of that at the end of the webinar. But just wanted to give some background. Sergio, please take it away, and thanks for hosting today.
No, thank you, Veronica. Thank you very much for that kind introduction, Dustin. Thank you, and to everybody that's out there connected, a big thank you very much for spending your time with me. I'll try to be as brief as possible, and I'll also try to show you and highlight the platform in a way that's conduit to your daily operations. So this is the very, very brief overview on the Health Gorilla platform. We are a fairly young company founded in 2011 as Informatica and quickly rebranded as Health Gorilla over the last year. Simply put, we are an online marketplace that allows doctors and their teams, such as yourselves and your practices, to connect to over 9,000 labs and over 35,000 radiology centers. Simply put, we are the Amazon of the healthcare world. Doctors and their teams can instantly place orders, get results, communicate, and completely eliminate the paper fax. Because once you're on our platform, we give every practice a free e-fax. And our solution is not only HIPAA compliant, but ONC Modular Certified for meaningful use too. And it's obviously through our partnership with Scripps Mercy Physicians partners, it's available at no charge to physicians. Currently, thanks to that very nice intro that Veronica read and I wrote, by way of experience, I actually come from your side of the world. I've been in healthcare all of my professional life. I've worked for IPAs, MSOs, ACOs, and health plans, If there's a role, I filled it. If there's a process, I worked it. I developed an ACO and sold an MSO to Stanford Hospital and Clinics. And I'm not really saying that just to give you laurels of accolade of the things I've done, but just to give you an insight into the fact that I basically have seen and done just about every facet that exists in terms of complicated and convoluted relationships in the healthcare market. Once you aggregate all of that, what we have experienced in terms of what exists out there, no matter what the relationship you have as a practice, because as a practice, you guys are on your own ecosystem. And then sometimes you have perhaps one, perhaps two, sometimes three IPA relationships, but that is not the totality of your business. Obviously, you guys have, EPO, PPO, POS, Medi-Medi, fee-for-service, Medicare. And what we are seeing in the landscape of medicine, and unfortunately, until now, no one has been able to solve, is that the challenges are the following. You guys have proprietary portals that only cover a fraction of a physician workflow, creating data gaps and chart fragmentation. While we definitely have seen the evolution of EMRs, and they are an amazing tool, the reality is that there are multiple isolated EMRs, and unless you are in an aggregated system like a Kaiser Permanente or a foundation-mandated system, you're going to find that you give me 20 doctors and I'll show you 15 EMRs. On top of that, and a sad reality is that the majority of us in practices and throughout the healthcare industry, we're still heavily relying on fax and paper. And on top of that, if that wasn't enough, you all have to deal with a multitude of lab and diagnostic vendors, each one offering his or her own portal. That leads to some, obviously problems with being able to provide comprehensive medicine by not having the full picture and control over preventative cares and readmissions and things like that. Basically, what we are, if you show you some very, very fancy slides, but if you were to say, break it down to me, Sergio, what do you give me? Quite frankly, through LabConnect and with our partnership with Scripps Mercy Physician Partners, what our platform offers is the ability for you to order bidirectionally labs from any lab vendor you want and get the results in your system. We give you a HIPAA-compliant, secure way of sharing that information and sharing charts and syncing all that data, and I'll show you the live system momentarily. And you have the ability to aggregate and communicate with one another. And the beauty of our platform, outside of the fact that it's free, is that it's completely agnostic. This platform works independently well for the physician or practice that is on paper. It works extremely well for the practice that is on an EMR. And we can seamlessly integrate with any major system as well. I would like to take a moment to defer to the panelists and our moderator, which is Veronica, to see if there are any questions so far. I'd like to definitely go through the presentation, but I would like to not have this be a one-sided monologue. Veronica, do we do questions at the very end, or can we take questions as the progress as the webinar happens?
We normally do the questions at the very end. Right now, no questions have come through.
Fantastic. I'm either boring everybody to sleep or I'm doing a fairly good job at explaining the platform. What I am showing you right now is the 2.0 marketplace. We had an earlier version that was very sophisticated for its time, but a bit uglier in terms of user interface. The new system is actually deployed in limited fashion and going live by the end of the week. So should you choose to participate with us through LabConnect and Scripps Mercy and Health Gorilla, this is the platform that you would see. As you can see, it is very reminiscent of a marketplace in that it has dashboards going horizontally and vertically. You have the ability to see all your results, all the documents, messages, referrals, and we're the only system where you can have the ability to sign, attest, and document signatures. We are the only one of the few Medicare certified systems that allow you to do e-signatures. One of the biggest successes and one of the reasons why physicians and practices and IPAs and aggregated groups use us, outside of the fact that we're free and that we're a marketplace, it's because of the issues and the workflows that we solve for them. As I said, we're an amazing tool for someone who is on paper, quite frankly. But because we are a completely open and agnostic platform, we fit on top of anything else, meaning that our biggest success stories and most best and most eloquent interactions and interventions has come by the way of interacting with practices that have already deployed an EMR. Now, why do I say that? I say that because an EMR is an amazing tool, and let me be very, very clear about the platform. The platform is a marketplace that allows you to order services throughout the medical community. We are not an EMR. We have no intentions of being an EMR, and there are 750 vendors already of them out there. I am sure that if you are in business or in the business of trying to get an EMR, there's plenty to choose from. What we are is a marketplace, and it's a marketplace that can interact with an EMR. The EMR is a tool by which doctors can oftentimes do their subnotes, dictation, documentation, and chart notes. However, the problem with an EMR, even in the instance in which it were to have a bidirectional connection with one lab or one rad, is that it's not a marketplace. And even though it may be an amazing tool for your practice, the reality is that once it's time for you to send your patient and forward the results, whether it's lab, whether it's radiology, to somebody else, the reality is that the physician next door or in the building down the street is not going to be in the same EMR. This system completely eliminates that. Not only can you order any lab from any vendor, you can order any radiology test from any vendors, get the results seamlessly into the system, and share them. So let me show you what that means. So as you see this is the marketplace. This allows you to discover for providers, diagnostic laboratories, radiology centers, physical therapy, where it moves into the skilled nursing facility, urgent care, surgical centers, sleeps, home health. So the marketplace, it's fairly broad. I am going to go ahead and find a patient to show you. And as usual, we're going to find my infamous fake data patient just for the purposes of the call, obviously disclosing that this is a staging system. John Doe is the doctor, and a fictitious Mariana Gomez is our patient. So this is the demographics. Our system has the ability to integrate with any practice management system and upload the information. So as you could see, we have the ability for Maria Gomez to have general information. We have the ability to capture primary, secondary, and tertiary insurance. We have the ability to display all results from Maria Gomez. So what I'm showing you is, regardless of the test, whether it came from Labcorp, whether it came from Hunter, whether it came from, it doesn't matter where the test came from, you have the ability to receive all that in your system. You have the ability to also not only view, let me create a filter so that I can show you there you go. You have the ability to view all of the results, whether you want to see the diagnostic test or radiology test. Now, the data has the ability to come both in paper format, and it also has the ability to come in discrete data, meaning we integrate with labs to the degree that we can get the HL7 information, or we can get the Diacom image, meaning that you can actually see the live image in the system. More importantly, any documentation related to the system, whether it's a note from a physician, you have the ability to capture. So if you go back to the beginning, the system has the ability to see and save all documents related to that patient. What we are is a master patient index. So not only do we give you the ability to order Diagnostic Labs, so I am going to go ahead and order a fake lab for Ms. Gomez. and say I'm going to send it to Labcorp. The system also loads all of the dynamic live compendiums of all the labs. So if I wanted to get a hemoglobin A1C, I'm going to take that and continue. And I'll say that this is the diagnosis. The system captured diagnosis, capture all practicing physicians, and you have the ability to do this. I'm going to save it as a quick order. You can not, you can submit it. I'm going to cancel it because this is a fake system that's not going to go anywhere. I'm going to go back to the funky. One of the most interesting system things that we've done to the system is you have the ability to do referrals. So in the setting which I was describing, that physicians can have an EMR or not have an EMR, the power of this tool is that not only does it allow you to order labs and get the results in the system, order radiology tests and get the results in the system. More importantly, once your ecosystem of providers are participating in the system, which is free, easy to use, and all it takes is a few clicks to register, you have the ability to create a seamless ecosystem in which you can share your patient data. Meaning that if I'm a primary care doctor and I wanted to go ahead and forward the information, I can take the entire information as it relates to the patient at hand and share it with a consulting provider. So that think about the power of this. If you're a primary care office or if you're a specialty office and you want to do a sub-referral for patient lot here, you can basically take the entire chart and share it with the physician. Now, quick point to make. The entire chart, what do I mean by that? Because of the fact that we are not an EMR, we are not going to be sharing access to data that we don't have, meaning physicians' private notes, SOAPs, dictations. What are we sharing? Well, the information that the system captures is all of the diagnostic testings, which in reality turns out to be 72% of a physician's chart. 72% of a member's chart, statistically speaking, is diagnostic in nature. That's labs, that's radiology, that's all of that information. Now, 80% of the time, a physician uses diagnostic testing to, issue a diagnosis. The system has the ability to share all that. The very nice thing about the system, let me show you this too, is that for aggregated system, it has the ability of sharing information. So that meaning that if I'm a doctor and I have 3 other physicians in my practice, I can begin and share and stop the sharing of that information. What does that mean? It means that if the 3 of us, there's 3 providers, Dr. Manias, Dr. Ho, and Dr. Astor, were all in the active treatment of Miss Maria Gomez, the 3 of them, these 3 physicians, could basically actively share all of the diagnostic systems. And any time that Miss Gomez went and got a lab, all 3 sections of the provider's chart would be dynamically synced because you are in treatment. This happens to be another physician group that we are working with here in Silicon Valley. IPAs love this because the same principle can actually be applied to an entire ecosystem of IPA patients, whereby the IPA says we need to actively manage whether it's pay for performance or the HEDIS measures, or just in general what's going on with our patients. So the IPA has the ability to share an entire system of populations, vis-a-vis all of the HMO patients that belong to one medical group, and enable their doctors that are in the middle of sharing treatment to be able to see what's going on with that patient. So let's see, a quick time check is about 12:30. I've been talking for about 25 minutes. So if you take anything away from what I've shown you in terms of the PowerPoint or in terms of the system itself, if you were to ask me to give you a 5-minute or 5-second spiel on what's the Health Gorilla LabConnect platform, what does it do, and what's in it for me, I would have to say that at its very, very basic value, the system enables you, your practice, your doctor to order from any laboratory and any radiologist vendor in the country. Have the ability to have that order be bidirectionally. Not only do you order, you get it in the system. On top of that, we allowed you the ability to view those documents, share those results with referring physicians, share orders. We give you a free e-fax. So what happens in the event that you're using this system, and so are 3 of your colleagues, but there's a fourth that says, not interested, not going to use it, I'm retiring in 2 days, so I'm still going to use the fax machine. It doesn't matter, because if you are on the system and that fourth physician is on a fax machine, whatever they sent you is going to be captured by the system as a message. And anything that comes into the system gets stamped and logged, whether or not it came electronically or via an outside fax. So basically, this could be an amazing correlation partner to an existing EMR, because EMRs are an amazing tool with some limitations. And those limitations, to be quite frank, are really limited to their ability to connect with every lab and rad vendor in the country, which they can't, and most likely they won't. Or if they will, they will do so at a very, very expensive charge. We are an agnostic marketplace that allows physicians to be able to view from a nationwide catalog and order tests, get results, share the results, and referrals, share a chart, have the ability to sign, and we eliminate your fax by giving you a free e-fax for the life that you are with us through Health Gorilla, completely eliminating the fax and having the system be a master patient index by no matter what comes in the system has a proprietary algorithm that does OCR text recognition. And even if you were to send a scribbled system that says Maria Gomez, the system would automatically find it, link it, locate it, and ID it as this is something that came in from Maria Gomez. We're going to put it directly in her chart. On top of that, as I mentioned at the onset of the conversation, the system is 100% HIPAA compliant, certified for meaningful use, which means that every action that is taken in the system is documented and cataloged for forever and ever. At this point, I think I hope that I have given you a fairly broad and comprehensive overview of what the platform is, how it works, and at its very, very basic, given our time here on the webinar, the ability to show you in real time, in a real system. I don't like to use slides. I like to show you exactly how it works. The ability to see and show you what the system and in real life looks like. So at this point, that concludes what I'd like to show you, and would like to pivot back to Veronica, to our MC, to see if there are any questions or some dialogue that can ensue in a back and forth.
Thank you very much, Sergio, for that demo. If anyone has any questions, please send them over so that we can get your questions answered. In the meantime, while you're thinking of your questions and maybe typing them in, Dustin would like to touch on a couple of items.
Oh, thanks, Veronica. Yeah, just Sergio, thanks again for the overview. On the point of the master patient index, we're currently speaking with legal counsel as well as other consultants, currently probably over the next 3 to 4 weeks roughly, to really hone in on how to be HIPAA compliant with the master patient index with using LabConnect by Health Gorilla. So that, of course, is a concern for any practice, and we're doing our due diligence to make sure that we have a strategy, the communications and documentation organized for everybody once the master patient index opens up for patients. The other note too is that the diagnostics and lab we have currently running is Labcorp, Quest, and Imaging Healthcare Specialists. Those systems are all online right now and active with the product.
Okay, no questions have come through yet, so I'll touch on a few other items here. Wanted to also let everyone know that currently we have over 100 physician members who have adopted and are using the LabConnect and is currently still growing. We'd like to see those numbers definitely increase and are offering lunch and learns monthly. Our first lunch and learn will be tomorrow, Thursday, October 23rd, here at the offices of Physician Partners. We are still taking RSVPs. And again, we are offering those monthly. So we definitely would like the offices to join us and learn more about LabConnect and get your office signed up. It is a free member benefit. So, it doesn't cost anything to get signed up. And if you do like still receiving the paper faxes, maybe, still sign up and just ease your way into the electronic usage. So, can ease into it slowly. Still no questions, so we'll go ahead and share the answers to the poll questions at the beginning of the webinar. So it looks like we have 75% that receive 20 or more faxes daily.
Another 25% showing 6 to 10. So on the heavy side, definitely the majority there. Here's the next one.
How much time per day do you spend organizing faxes? So it looks like it's about 50-50 within an hour or 3+ hours.
Okay.
So
that would correlate to the amount of volume, obviously, from the previous question. Here's the last one.
Last question, would you like to seamlessly share diagnostic data with your colleagues? 100% answered yes.
And that goes back to the master patient index that Sergio had mentioned before, making it seamless and really automatic in order to do so.
Right.
Sergio, are there any other points that you'd like to make? Again, if anybody has any questions, please send them through. But are there any points you'd like to make here before we conclude?
Yeah. Again, thank you so much all for your participation, and again, sincere gratitude to Veronica and Dustin and the Surgicenter Physician Partners. I guess the closing remarks that I'd like to leave is one, you are very much in line with definitely the rest of California in terms of the number of faxes, more or less, that you are receiving and the number of time or hours that it's taking to basically deal and sift through all that data. I'd like to think that actually Health Gorilla can help you eliminate that, because first and foremost, all faxes would come into the messages, and the system would automatically catalog them into the right patient bucket. And then to Dustin's point and follow-up, as we collectively are thinking and vetting through, the given situation with the attorneys to make sure that everything is 100% HIPAA compliant on the already HIPAA compliant system, the way to seamlessly share diagnostic and lab radiology services today outside of the patient master index, it's already available, meaning that if I get results, as I'm showing right here for Ashley Dominguez, and if I want to share that result and send it to one of my colleagues, today the way which you do that is to send a referral to your provider. Basically, it's a click of a button and you share it with your one-to-one treating physician. Outside of that, I would like to publicly commit myself so that if there are any questions or afterthoughts that came to you, please do not hesitate to jot those down and get into Veronica and the Scripps Mercy Physician Partners folks. And I will commit myself to make sure that every single question that there is satisfied within a timely manner. And I once again thank you so much for your time and participation, and I look forward to working with you.
Sergio, we did have a question come through. The question is, with LabConnect, will it meet the requirement for meaningful use stage 2, menu 3 regarding imaging results?
I'm sorry, could you repeat the question?
The question is, with LabConnect, will it meet the requirement for meaningful use stage 2, menu 3 regarding imaging results?
Yes, we do.
Yeah, I mean, Sergio, you really regard it as a modular MU2 certified tool, correct?
That's correct. So basically, let me be further amplified. So the solution is a modularly certified for meaningful use too. What does that mean? It means that for the modules that we cover, which are lab and rad, we are fully certified. Now, how does that differ from an EMR that is 100% meaningful use compliant? Let's not use name. Let's call it EMR ABC. EMR ABC is an out-of-the-box EMR that basically is quote-unquote meaningful use, 100% compliant. The practicality and reality that most EMR face is the fact that an EMR is in the business of, quite frankly, making money. So a connectivity to a lab vendor or a rad vendor will run the practice or whomever pays for it somewhere in the vicinity of $5,000 to $15,000 per connection. Because of that, and because of the fact that most physicians, on average, use at a minimum 3 to 5 labs and at a minimum 3 to 4 diagnostic facilities, it becomes somewhat cost prohibitive to have every connection live inside of an EMR. Therefore, physicians resort to using a paper form by which they send patients to get services from labs and imaging centers that are not directly interfaced with an EMR. So when it's time to attest for the meaningful use thresholds for electronic ordering and results receiving, the EMR falls short because it doesn't have the connections in place. LabConnect via Health Gorilla eliminates that because our platform is 100% compliant in that we track every single click electronically for order, send, submission, and receipt.
Thank you, Sergio. I'd like to let all of the participants know that we do have an option form for LabConnect. I'll send it to all of our participants for you to take a look at, and if you're interested in moving forward, we just need a signature and fax it back to me, and we'd be happy to get you started with LabConnect. It doesn't look like any other questions have come through, so thank you again for participating. Thank you, Sergio. If any questions come to us, we'll direct them to you.
Yep, and we'll get the slides out to everybody with a link to download tomorrow. We'll have the recording done in about a week, and that'll be available as well.